So here we see this lymph node right here. It's below the ilium. That's a subiliac lymph node. Sometimes it's referred to as the prefemoral because it's in front of the femur, but no, it's the subiliac lymph node. Okay, so this is our external abdominal oblique muscle. And we reflect that down. We follow its aponeurosis up under here, and we can see that we have a slit in the aponeurosis right here, and coming through that is the cremaster muscle and the spermatic cord. Okay, and the goat, they have a very big cremaster muscle. Okay, so this here is the superficial inguinal ring. If we follow that aponeurosis of the external abdominal oblique back up in here, and we find its caudal border right there, that's going to be the inguinal ligament. Okay, now let's come open up the abdomen this way. Okay, here we have a kidney. We'll open that kidney up in a bit. And here we have the ureter. So the ureter's been cut, unfortunately, but we can see the renal artery coming up here into the aorta, and just cranial to it we should have a structure. Here we go. So so this structure at its cranial pole, if we cut it, oh, this one's not very good. It should have a prominent cortex and medulla. This one doesn't have it so much. But this is the adrenal gland. Okay. So real quickly here, I wanted to show you the kidney of the small ruminant. So we have our renal artery and vein coming in, as well as our ureter coming out at the hilus. We've got a cranial and a caudal pole. Looks very much like the dog kidney. We opened it up and it still looks very much like the dog kidney. We can see total fusion of the cortex here, the medulla down here. You can see these vessels here. Those are the corticomedullary arteries. And then down here we have the crest, and this space here just adjacent to the crest here is going to be the renal pelvis. And then you see that hole there, that is the opening into the ureter. Okay, so that is the kidney of the small ruminant. So if we come back in and we look in this way, we can see here the testicular vessels coming down, and it's joining with the Ductus Deferens right here, and it's going in through the vaginal ring into the deep inguinal ring. Okay, so the deep inguinal ring, its boundaries are the caudal border of the internal abdominal oblique, the rectus abdominis or the prepubic tendon, and then the caudal border is going to be that inguinal ligament that we can't see here. It hasn't been dissected out. Okay, so this is our vaginal ring, which is basically the peritoneum, where it changes from parietal peritoneum into parietal vaginal tunic as it descends down with the testes. So looking on the medial aspect of the thigh, we can see our tensor fascia lata here. It's overlying our quadriceps femoris. We can see our sartorius muscle here, our gracilis muscle here, and then what we've done is cut that gracilis and the adductor down to the pelvic symphysis, and that exposes the root of the penis here. So I just wanted to show you that. So you can see here the two retractor penile muscles coming down and attaching to the sigmoid flexure right here. Okay, so most of what we're seeing here is the root of the penis. We're going to have the sigmoid flexure a little bit further, but we can see nicely here also the bobospongiosus muscle and the Ischio Cavernosus muscle here attaching to the root of the penis. Once again, that's our retractor penis muscle. We can see the spermatic cord here with a very prominent cremaster muscle. So remember that cremaster muscle is going to be coming from the internal abdominal oblique. So we have our external abdominal oblique, our internal abdominal oblique, and if we look down in here, hopefully you can see the caudal border of that internal abdominal oblique. It's got a segment that is going with the spermatic cord out through this superficial inguinal ring in the aponeurosis of the external abdominal oblique. Okay, we take that on in here. Okay, looking at the other side, we can see the ductus deferens here, the testicular artery and vein here, going down through the vaginal ring, which is just a ring of peritoneum. Remember, the parietal peritoneum at the vaginal ring evaginates in to become the parietal vaginal tunic. So now we've cut it at the ilium and along the symphysis pubis so we could reflect the limb like such. And we will remove that limb. But I want to show you here very nicely. We have, remember, our external abdominal oblique, its aponeurosis. Here's our subiliac lymph node. And here we have the superficial inguinal ring through which the spermatic cord and the very prominent cremaster muscle pass through. Okay, remember also passing through are going to be the pudendal artery and the genitofemoral nerve. I don't have those dissected to show you that here now, but if we then reflect that external abdominal oblique, we see the internal abdominal oblique muscle, and its caudal edge is giving rise to our cremaster muscle. Okay, and remember, its caudal edge is also our cranial border of our deep inguinal ring. Okay, so what I've done now is I've cut and reflected those abdominal muscles, and so we can see very nicely here. Here are the testicular vessels coming in, and here is the ductus deferens entering very nicely into the vaginal ring and then the deep inguinal ring. Okay, and so then see, there's those testicular vessels again right there. So over on this side we can't actually see the spermatic cord, even though I kind of have it tucked on my fingers here. It's going to be running, it's still within the parietal vaginal tunic down through here, but what we also see right here, so here's our external pudendal artery coming out, and this is our genitofemoral nerve. So we see both of these are also passing through the inguinal canal. So once again, here we see external pudendal artery running with the genitofemoral nerve, which is in here. Okay? Cool beans. And so also what we see here as we see the rectum is up here. We've got this structure here, which may be confused as the prostate, is actually the seminal vesicle or the vesicular gland. It's more properly called vesicular gland in the ruminant because it is more gland-like rather than a vesicle. And the prostate is not very prominent on these guys because most of it is disseminate, which means it's within the wall of the pelvic urethra. Okay? And we're going to dissect all this out later. I just want to show you this very nice view here. So here we have a very nice view of our internal iliac. Remember that internal iliac does not become the internal pudendal until the caudal gluteal comes off. That caudal gluteal artery is coming off here. And so this portion here is the internal pudendal now. And that's going to give rise to our artery of the penis down here. And so we have our pelvic urethra in here. We have cut the crus of the penis here, which is covered by the Ischio Cavernosus muscle. We see back here the bulbospongiosus muscle. This is the root of the penis. We have very nicely here the two strips of retractor penis muscle coming down to attach on the sigmoid flexure. Here we can see very nicely that sigmoid flexure of the penis. Okay, so in these guys, erection is going to occur by straightening out that sigmoid flexure. Okay. So now if we open this up here, we see that especially in the billy goat, there's a very prominent tail of the epididymus. Remember that cremaster muscle is attaching to the outer surface of the parietal vaginal tunic. And so this testis and epididymus is still within that vaginal tunic. And we'll open that up later to reveal that to you. Okay, so that's the cremaster muscle here. And we'll come back to this later, but this is really nice. I had to show you at this point what we got. Okay, so one of the things I want to try to show you before we go on is the pouches associated with the pelvic cavity. So we have a pouch here that basically surrounds either side of the mesorectum, and that's going to be the pararectal pouch. And then we have a pouch here that is between the rectum and this folded tissue. You see the Ductus Deferens are coming up here, and they got this folded tissue between them, which is known as the genital fold. In the female, it would be the vagina and the uterus sitting here. Okay, so that between the genital structures and the rectum is the rectogenital pouch. Rectogenital pouch. And then between that fold and the urinary bladder is going to be the vesicular is bladder, vesicogenital pouch. Okay, and then between the urinary bladder and the pubis would be the pubovesical pouch. Okay, so those are the pouches of the pelvic cavity. The Ductus Deferens coming off here and around here. We had another one in this part of the fold over here. Okay, and so this is our genital fold. So I want to show you here once again. We can see the accessory genital glands in the male goat. We can see a very nice dilation here of the Ductus Deferens. Okay, So here we can see that Ductus Deferens coming from here, coming back up, and this dilation is known as the ampulla of the Ductus Deferens. It's the ampulla in the vesicular gland. It's going to secrete fructose for energy for the spermatozoa. And then we have the very lobular vesicular gland. And the horse is referred to as the seminal vesicle because it is more bladder-like. We see here, as in the ox, it is very glandular-like, very bumpy. Now we see a structure right here that looks very similar to the body of the prostate in the ox. Okay, I don't know that that is what it is in the goat, because the goat's prostate gland is that disseminant portion which is in the wall of the pelvic urethra. Okay, so if we cut that wall, we would see that, okay, there we have the urethra, we have some cavernous tissue around that, and then that prostate gland is incorporated into the wall here. Okay, so that's known as the disseminant portion. So we see urethralis muscle surrounding the urethra here, and then back here we have the bulbourethral gland. Okay, so those are the glands, the accessory genital glands of the goat. And then we go into our penis here. Once again, this muscle that was surrounding the crus, and the first part of the penis here is the Ischio Cavernosus. It attaches to the ischium on the ischial tuberosity and comes around to attach here. Then we have this muscle here, which is the bulbospongiosus muscle. Then we have our two retractor penis muscles. So here I've cleaned up so we can see that sigmoid flexure of the penis very nicely. Okay, so these guys have fibroelastic penises. Okay, it's true of ruminants as well as the boar. And so because there's a lot of fibrous tissue in there, they don't expand with blood engorgement, but they stretch out. Okay, and this guy just kind of pulls it back in. And so as we come along here, we're going to have right in this area here a lymph node. That's going to be the superficial inguinal lymph node. And we come on down, and in our prepuce here, I've opened it up so that we could see this bulging portion here is the glands of the penis. And then this little part here is the urethral process. So this is actually an extension of the urethra that comes on out of the penis here. Okay, so that's urethral process. This is the glands of the penis, and then the rest of the penis here. So now I've transected the penis, and you can see here it's surrounded by a white fibrous coat, which is the tunica albuginea. It has the corpus cavernosum here, corpus spongiosum here, with the urethra right in the middle, just like all mammals. Okay, so now I want to do is I want to cut open. Oh, before I do that, I want to show you. So you can see here in the scrotum there's actually a division here, a visible division between each side. You can actually see where the tail of the epididymus sits, because as I showed you earlier, the tail of the epididymus is quite large. And so now I want to open up this vaginal tunic here so that we can expose testis, the epididymus, and so forth. So our pampiniform plexus, which is important for cooling the blood as it's going to the testes, didn't get any latex in it, but this is the pampiniform plexus here. And this is our Ductus Deferens coming down here. So we have a mesoductus deferens, and the mesorchium is what's attaching this to the parietal vaginal tunic. And you can see here it's coming down, and here's our tail of the epididymis, and it's attached to this here by the ligament of the tail. So this is the ligament of the tail, the epididymis. Here we can see now the head, the body, and the tail of the epididymis. Okay. So we have a very close attachment here from the visceral to the parietal vaginal tunic. So this is shiny surface is visceral vaginal tunic, and that's parietal vaginal tunic. So once again, that's the cremaster muscle. It's outside the parietal vaginal tunic. We have the parietal vaginal tunic here, visceral vaginal tunic here, pampiniform plexus. We have the head, the body, and the tail of the epididymis. Then we have the ductus deferens coming on up through here. And that is the male reproductive tract.